guys, welcome to the channel, or welcome back. I thought in today's video I would give y'all what y'all have been waiting on, which is the back surgery part 2. So I think where we left off was where at the end of May we finally got a surgery date for June 20th, and the couple weeks after that were really stressful, trying to coordinate with my doctor and the diagnostic center, trying to get everything coordinated as far as like testing. Our diagnostic center is where our is like the outpatient area where you can get blood work, EKGs, x-rays, MRIs, all of that fun stuff. So trying to coordinate that was stressful, and coordinating with my work to take off for at least 8 weeks, if not a little longer, because this is a major back surgery and it takes a lot of downtime and recovery time. So got the blood work, x-ray, and EKG done, I want to say about 2 weeks before my surgery. The first round anyway. And most of it came back good, and they were just some white blood cells because I had a really bad cold. So that came back a little high because I just recovered from being sick. I forgot to mention that in my last video. So the physician's assistant that works with my surgeon, Mark, who I talked about in my last video, I forget if I mentioned his name, but the PA who I worked a lot with, his name was Mark, and my surgeon's name is Dr. Matthew LaFleur. I love him if you're in the Hammond, Covington, Baton Rouge area. And then Wednesday I think this is where I left off in my last video, but didn't go into a ton of details because the video was already kind of long. June 19th was the day before my surgery. I had to go get a little bit more blood work. They double checked my white blood cell count just to make sure it was a fluke because of me being sick, and they did a whole bunch of testing to get my blood type, make sure there wasn't any antibodies or anything like that they needed to know. And I remember mentioning this in my last video, but I will mention it again, and I will link my back surgery part 1 either in the description or in the comments. So check both places. So I went and got that blood work, and during that blood work, they check your blood, they figure out your blood type and all of that, and then they give you this band. And they pretty much say if you show up to the hospital tomorrow without this armband, your surgeon has every right to cancel your surgery because this armband has a barcode that is also connected to the blood work that they did, and it shows them like your blood type and any other important information that they need to have in case of a blood transfusion. They have everything ready if you bleed and would need it. They hope you don't, but they want to just have everything right there quickly ready to go so they don't have to go digging in your chart for that information. That night, they told me to shower like normal, and then they gave me these wipes to use, excuse voiceover from my phone, but they gave me these wipes to use that I wiped down with. They were these antibacterial wipes just to make sure there wasn't any infection on my skin. And they said, wash your sheets, make sure your sheets are washed and ready to go for when you come home from surgery. And then the next morning, I wasn't allowed to put on any lotions or anything like that. And I had to be at the hospital, I believe, I think it was 7:30. 7:30, 7:45, something along those lines. And from there, whenever I first got there, you check in to, at least at North Oaks. I ended up staying in the hospital for 3 days. But for North Oaks' surgeries, I think everyone checks in the same place, which is the second floor, so they can get you situated. And so I came up there, I checked in. They said it shouldn't be too long. They gave us a pager to let us know when it would be time to go in the back. And then about 10 minutes later, 10-15 minutes later, they paged us and we went into the back. They gave me more of the same bacterial wipes that they gave me to use the night before. I wiped down and changed into a gown. And then a few minutes after I got changed, they came in, went over all of my medical information, made sure that was good and up to date, that nothing crazy had changed. And then they came in. All of this happened over about a maybe about a 2.5 hour period, because I think my surgery was set to start at around 10, but I could have the timing of that a little off. But I think that was when my surgery was supposed to start, between 9:45 and 10. So this was, once I got brought to the back, this was all over about a 2-hour period. So after they checked my medical info, a nurse came in and started my IV. And then I think we had after that about a 20-minute gap after the nurse put in my IV. Then anesthesia came around. The anesthesiologist just came and talked to me and made sure, asked me a few questions, made sure he didn't have any major concerns before putting me under, made sure I didn't have any questions, all of that fun stuff. And then we waited a little bit longer because my surgeon was finishing up the case before me. And then my surgeon, Dr. LaFleur, came in and he was like, "Hey, good morning, how are you? Got any questions?" Let my family know about how long the surgery would take, which it was, I think, about supposed to take between 2 to 3 hours. This is where it starts to get kind of blurry for me, because shortly after that, a couple nurses came in and they put some relaxation medicine into my IV. It wasn't the medicine that completely put me to sleep, but it was it like relaxed me to like, I didn't care. I was like, wee! Like I was on cloud 9. And so they gave me that medicine before they rolled me into the operating room to relax me. And I was like, I just clearly remember just being like, bye. Like, just like waving at my mom, like, bye bye. Like I wasn't going into major spine surgery, even though, I was, just because I was on that good of medication. Then they rolled me into the operating room on the stretcher I was on, and then they're like, okay, we're gonna give you the medicine now to actually like put you to sleep. And that's like the last thing I remember. And I'm going to tell you like what I know from the surgery, from like what I was told and things I've been able to like piece together. So the surgery that they did was on T11, T12. I had a major bulging disc that was putting pressure on some nerves, and it was sending shooting pains down in my legs. Like I explained in the other video in more detail, I had tried PT, I had tried injections, anything I could think of, and it just wasn't going away. So I decided that with my surgeon that it was the best to get that disc off of those nerves to help me be able to work in a less amount of pain. And so they went in and they got that piece of disc out and then put a piece of bone in where they had to take it out because it was on my right side. So like on the right side, they took the piece of disc out that was pressing on the nerves, put a piece of bone in, and then screwed that bone in place with a couple of screws. And so then that I think took about 2 or 3 hours. Like I said, I was knocked out, so I really don't know how long it took, but Dr. LaFleur told my family that it was definitely a necessary surgery, that basically there was a lot of inflammation and I forget the words he used, but there was like blood vessels, like a lot of extra blood vessels around that disc, which can happen when there's just a lot of inflammation and things like that. So he said that I was in a lot of pain, and I was not exaggerating, and this was definitely a necessary surgery. And so I was glad we got it done. And so after the surgery, Dr. LaFleur went and told all this to my family, and then I was in recovery. I was told that I had a little, not major, but some trouble coming out of the anesthesia. I had, they had to keep me, because they put you on a ventilator when they do major surgery like this. I think they either had to put me back on, I have to ask again the events of the timeline, if I get anything wrong, majorly wrong, I'll do a part 3 and amend my mistakes. But they either had to do a part 3, they either had to put me back on the vent or keep me on the vent a little longer than what they wanted to, because while I was waking up, I was struggling to breathe a little bit, but they soon kind of were able to get that turned around and get me back on the right track and get me starting to wake up. And I cleared, like, my first clear or kind of half clear memory was when I was out of recovery and they got me in my room and got me in the bed in the surgical, like, neurological and surgical, like, I think it was like the orthopedic and neurological unit for people recovering from surgeries. And I was coming to, like, my first memory was, like, being in that bed and, like, my mom and my grandma were in the room and me just, like, being like, yay, so it's over. And, like, me being, like, so naive the first couple of hours because I was so completely, like, still loopy from the anesthesia that I was just, like, texting people in my phone that, like, texting, like, some of my friends and stuff like that, like, yeah, I just woke up from surgery, and because I was able to eat pretty quickly after that, I was just, like, sitting in my bed, like, laying in my bed, sipping on some root beer, eating some M&Ms, like, those first couple hours, because I was so loopy, I was like, yeah, I'm doing fantastic. And, like, I'm fabulous. Like, y'all don't worry about me. I'm doing fabulous. And once the anesthesia wore off a bit, that's when reality came for me. And I was in an extreme amount of pain, which would make sense because, you know, my doctor just operated on my spine, and that first night especially was really rough. Them trying to get me comfortable. I cried a lot. I didn't sleep a whole lot. We finally figured out a system that halfway worked that got me a few hours of sleep. And this is to no fault of the medical staff, but I remember one of the most frustrating things to me that first night was, like, I finally fell asleep at, like, 2 a.m. because, like, that was, like, how bad the pain was, that it took, like, several hours to get me comfortable enough to be able to fall asleep. Like, I remember falling asleep at 2 a.m. They had to come in at 3 a.m. to check my vitals. So I was annoyed that they had to wake me up to check my vitals. Then at 4 a.m., someone else had to come in and do blood work. And of course, they can't take it from your IV. They have to stick you again into more blood work. And then an hour later, my nurse comes in and goes, hey, sweetie, since it's been about 12 or so hours from when you came out of recovery, Dr. LaFleur says said in his notes that we need to get that catheter out, because I had a catheter in me because they didn't really want me moving a whole lot the first several hours. But I was like, sweetie, what? Like, why couldn't this wait a few more hours? And she's like, I'm just following doctor's orders. And I'm like, I'm sorry I'm grouchy, but I've literally gotten, like, 3 very broken up hours of sleep, and I'm in a good bit of pain still, but finally somewhat tolerable enough to sleep. And she's like, I get it. And so they got the catheter out, which made things a lot more tolerable. And then after they took the catheter out, I finally was able to get like 2.5 hours of sleep. And then they brought me breakfast. For about a week after, I wasn't able to really eat a lot. I would maybe be able to eat like a yogurt or like half of a hamburger or like a fourth of a hamburger. But like I was able to eat a little bit. And then what else happened? And then another frustrating thing would be that, which is no fault of the medical staff, I think, they just had way too many patients that, let me make sure we're still
Speech
recording.
on. 20 minutes, 58 seconds.
Yeah, we're good.
Speech off.
Okay. So they would, they had a lot of patients. So, it'd be time for me to get more pain medicine, because trust me, y'all, I'm not a drug head. But after you get major spine surgery, you are like, you best bring me my pain medicine on time or it's not going to be fun. I know I'm going to be hurting and I don't want to hurt. So you would, push the nurse's button to bring you pain medicine when it was time. But then it would bring, it would be 15, 20, sometimes 30 minutes before they could bring you your medicine, because they're like in the middle of something. And so that was really hard for me, because, by that time they would show up and you would be in a lot of pain and just be like, can you put something in my IV? Like, please help me. And they were, just following doctor's orders and saying like, no, you have to take this pill first and then this pill, and then we can put something in your IV. And that was just so hard for me. And then in the midst of that struggle, trying to get all of that sorted, physical therapy came in to get me up and standing. And I was in a lot of pain to begin with. And that was horrible. I remember I stood up, because while I was laying down in the hospital, they didn't make me wear my brace because I was in a very small hospital bed. I couldn't move a whole lot in that hospital bed, and I was laying flat on my back. So they, now that I'm home, I have to wear this brace pretty much 24/7, except for when I shower. But there, because they could keep such a close eye on me, they didn't really make me wear it, except for when PT got me up. And the first time they got the brace on me and I stood up, like, I could just, like, as soon as my feet hit the floor and I stood, I just lost it, because I was in so much pain just laying down, and then standing up, like, that pain was just to the extreme. Like, I just felt, after, when I kind of came around a little bit, I felt so bad for that physical therapist. I think his name was Chad, and because I don't really know for sure, but I think that's what it was, because I only saw this particular therapist, like, that one time. And I just felt so bad for him, because I was just sobbing, like, full-blown, like, mental breakdown, ugly cry sobbing, because it hurt that bad. And then he's like, okay, can you just take a couple steps for me, just to prove to me that you, like, physically can, and that we don't need to, like, call an emergency. And I was like, okay. And, like, that was just, like, so incredibly painful. And so then they got me back in the bed, thankfully, and I was just in so much pain. And one of the physician assistants, I forget his name, but it wasn't Mark, who I usually see, but another one came around like an hour or so later. And I finally, like, got him to understand, like, what I needed pain medicine wise. And he was the first pill they gave me that took like in 30 minutes to an hour to kick in. Even once it was supposed to kick in, it didn't help me. And I was like, okay, like, but the second medicine that they gave me was helping to some degree. And I was like, can this medicine be our first line defense? And he was like, yes, since you're advocating and speaking for yourself, we can do that. So Friday afternoon was a little bit better because we were, he understood and we were able to do that. And then, so when the other physical therapist who I saw over the weekend, David, came around, I was feeling a little bit better. So I was able to, like, because we got the pain meds figured out a little bit, I was able to walk like half a hallway. It was maybe like 100 feet, and then went back to my room and laid down again. But then Friday night, I remember I had these poor nurses. Poor them. Or just the poor medical staff. I had another mental, and my poor mom who stayed with me the whole time. I just remember having another mental breakdown, because one of the doctors changed my pain meds again. And so we had to go through, this whole system again to get me halfway comfortable to get some sleep. And I just, lost it. I was like, oh, why is this happening? And was, not in the best headspace. And so, I, finally got the medicine. We finally did something and got me to where I could get a few hours of sleep. And I remember when the nurse came in again, at around midnight, 1 a.m., I would apologize to her, and I was like, look, I'm sorry I went off earlier. I wasn't mad at you, I was mad at the system. And she was like, I get it, this sucks. And and we just talked about it for a long time, that how it sucks that doctors just change things and don't always communicate, and when you're in that much pain and it just throws you off, you lose it. And she's like, I completely understand. She's like, it was obvious that you were not okay. And she's like, I could tell that you weren't really mad at me. You were mad that this got moved around again. And so she helped me out the best that she could. And then it was, then I was able to doze back off for a little bit. And then it was annoying. They came in to check my vitals again at 2:15, 2:30. And, the guy who came and checked my vitals, I think he was a CNA or something, left me, at 2:30 in the morning, brings in another set of bacterial wipes, and was like, it was a dude. So I was like, no, I'll wake my mom up or wait until the nurse comes back. And he's like, you need to wipe down with these again, and hands me these bacterial wipes at 2:30 in the morning. And I was like, what is this? I'm not doing this at 2:30 in the morning. And then so like when the nurse came in a few minutes later, I think I was like due for medicine, or she came to see if I needed more pain medicine or something. Change some like either give me more fluids or something was due. She saw the wipes on my chest, and this is like why I really ended up liking this nurse after all. She was like, "Why are those wipes sitting on your chest?" And I was like, "Because the tech left them on my chest, and it's like handed them to me, and I put them on my chest." I shouldn't say left them on my chest. Like, I put them on my chest because I didn't know where else to put them. Because I didn't have like a good nightstand by my bed at the hospital. I was like, I'm debating on if I want to wake my mom up to do this at 2:30 in the morning. And she just like leans over and grabs the wipes from me and walks over to the table and puts them on there. And she goes, "No, they'll be here when they wake you up for breakfast in the morning. That's stupid." And I was like, "Thank you. I thought it was stupid too, but like I wanted to verify it with you that like that could wait to like 8 a.m. or a more reasonable hour." And she was like, "Yeah, that can wait till it's not 2:30 in the morning and you're running on very few hours of sleep." And I was like, "Thank you." And then they came in again and got labs. And then Saturday, nothing remarkable happened that I remember. They got me up a couple of times. The second physical therapist, David, got me up a couple of times, walked up and down the hall. It was still hard, but I think we're getting me more halfway comfortable. And then Sunday, we were in the word on the street was maybe Sunday I could go home if I can continue to not need anything over IV through Saturday night. We could talk about me going home on Sunday. And then Sunday came around, and I was so happy that it was a nurse practitioner that I knew. Her name is Ray, and she treated my shoulder because I've had some problems with my shoulder in the past. And she walks in and she goes, "I remember you." And I was like, "Yeah, I remember you too." And we talked for a minute, and I explained that the short-acting pain medicine called Roxycodone helped me more than the one that took an hour to kick in. Can you send me home with that instead of the longer one that takes like 30 minutes to an hour to kick in that I can't remember the name of? And she goes, "Yeah." Like, she goes, some patients I would be a little hesitant to send home with that prescription. But she goes, "Because I know you and I've seen you before, and I know you think pain medicine is from evil places, because if you know me, I hate pain medicine. If I'm not careful, pain medicine can trigger severe migraines for me, like severe rebound migraines. So I tend to avoid pain meds when I can, but I knew I was going to need them for this." So she's like, "Yeah, I know your feelings towards pain meds, so I know you're not going to abuse it, so I'm comfortable with you using that." So we went over the fact that like I had to keep the site covered 100% of the time for a week, and then I could take the we had to change the Band-Aid every day, but had to keep it covered and stuff for a week. And then after that I could put a Band-Aid on for like comfort, like only if I needed it. So we went over all of that. They gave me the prescriptions, and then they wheeled me out because they didn't want me to have to walk that far. Like, they do want you to walk like short distances, but they didn't want me to have to walk all the way to the car. So, because we were on the 5th floor. So they wheeled me out to the car. Then we went home. I think we went and got my medicine because they already sent over the muscle relaxers and dropped off the pain prescription. Because they, at least the doctors at North Oaks generally won't send a pain, like, you can't electronically send a pain prescription. They will just give it to you by hand, and then you have to bring it. I think it's because it's a controlled substance. I don't know if it's like that everywhere, but it's like that at most of the hospitals around here. But then we went home and got me situated. But I think because this video is at least already 30 minutes, this is where I'm going to leave it. And I don't want to promise what day, but in a few days I will do maybe tomorrow, maybe Sunday afternoon I'll post it, because I know it's like Saturday night-ish, or it might be Sunday or Monday whenever I post the, like, so right now I'm about 3 weeks and a couple of days from when I got home, because my surgery was June 20th, and I got home, let's see, June 21st, June 22nd, June 23rd. So my next video in this series will probably be my how am I doing 3 to 4 weeks post-op, how was the first week at home, all of that kind of stuff. If y'all have any questions, leave them down below. Thanks. Bye.
Speech on. 37. Stop recording.